And welcome back to The Factor Uncensored. It doesn't matter what your job is, anyone can suffer from burnout, especially nurses. Issues of short staffing, stress, and just being overworked were amplified during the COVID pandemic, and it continues on now. My next guests both work in the healthcare industry. They share their insight on the problem. And joining us on The Factor Uncensored to talk about this topic is nurse practitioner Adrienne Allen and Dr. Danish Ali from Archpoint Pain Institute. Adrienne, when you take a look at this report, this study indicating the difficulties that nurses may have in the hospital system, do you agree, disagree? What is it like out there in the trenches?
100% agree with this, and it's many nurses' sentiment on short staffing, exhaustion, and the mental effort it takes to take care of people's lives and keep them safe.
And when you have that person's life in your hand, but then you have an incredible workload, how do you even balance that?
Your phone's ringing, people are calling, you're running around, and then there's a code blue. I really don't know how we handle it. I think that it takes a great multitasker, and it takes a person who prioritizes their task well.
But I'm sure you've seen individuals, nurses in your industry who have said, look, I can't do this anymore.
You know, your mental health and how you take care of yourself outside of work is one of the most important things. Once you get home, you really have to pour back into yourself because you are giving so much of yourself in caring for these patients. So I think self-care and mental health is very important.
And Dr. Ali, you are around many of these nurses at the hospitals where you also work in addition to Archpoint Pain Institute. What is it like seeing many of them working so hard and getting frustrated as a result of the system that's in place?
Yeah, Isaiah, it's hard, right? I mean, ultimately we have patient conditions that are so challenging sometimes. Sometimes we have families to deal with. And then on top of that, the burden of the nursing care, being short-staffed, overworked, having other illnesses potentially as well. So it's a lot, Isaiah. And so that's why, as Adrienne alluded to, self-care, taking care of yourself is so important when you are off work, and making sure that when you are off of work, you can offload and you can stop thinking about all the things that just happened in a hospital setting or even in a clinic setting.
And big picture, what do you guys see as a solution to this problem, the tremendous pressure that many nurses around this country are under?
Isaiah, I think we need to hold the hospitals more accountable. We need to hold some of these folks that are in charge of hiring. There's such a shortage. We need to educate and teach, have more nursing schools, have more postgraduate schools. We need more funding for the nurses staff, even for the medical staff. Graduate medical education is so important. Medical school funding is so important. So all of these are things that we're lacking, Isaiah. And it's just unfortunately getting worse and worse because, as we have folks that are aging, the hospital systems are being loaded with patients, and there's just not enough staff to adequately take care of those patients.
And from your perspective, Adrienne, what would you suggest? The hospitals do in order to address this issue, this problem?
I think that we need more nurses. The hospital should incentivize people in the communities around them to go to nursing school. They should provide resources to people because nursing school is no easy feat. There are many people who want to become nurses, but it's simply difficult. And I do believe that the schools should also participate in working with hospitals to help nurses get through school and get through it faster. We just need to increase the workforce. Also, the government can get involved by mandating that nurses don't have to work if they can't. A lot of times you could try to take off of work because of whatever, or work your 3 days and have your 4 days off. And the hospitals are saying, well, listen, we need you to come in. So it's almost like mandatory overtime.
Mhm. And you feel that pressure because you fear losing your job.
Absolutely. Absolutely. I mean, there are a lot of jobs available, but when you have a great working environment, you want to stay in that place. You don't want to always go back and forth and go around and get different jobs. So nurses want job security and they want to feel safe in the place that they're working.